We must not forget, as we have already clarified in the biomechanical process, that the main treatment for a listhesis, besides producing analgesia in the area, usually by physical agents, should be to work from the biomechanical point of view at the level of the cervical spine, the dorsal spine, the sacrum, and the ischiotibial muscles. Therefore, we can use several techniques. But the most used and the one that has given the best results in my personal experience is the use of sacris. Fundamentally in the early stages. The first 2 or 3 sessions of treatment I relax the ischiotibial muscles, and I seek the correction of the sacral process, as I am correcting the alterations at the level of the cervical and lumbar spine. Remember that listhesis also produces shortening in the muscles of the abdomen and bulging and deformity in the thoracic cage. Then it is also important to use sacris to relax the diaphragm. And in this way, it also helps us to orient and balance the dystonia that exists between these muscles. Right after the 3rd or 4th session, when the patient has evolved and has managed to correct a bit the horizontalization of the sacrum, and the upper segments and the ischiotibial muscles have been relaxed, it is possible to proceed with the use of Cordus, mainly to work the cervical and dorsal region, and to work the sacral region. Once we are through the treatment stage, we move on to provide relaxation to the patient's ischiotibial muscles. And finally, the last stage or 3rd stage would be to indicate the patient to work directly with Cordus and sacris at their home, and periodically perform exercises in the clinic to strengthen the muscles of the lumbar spine, which as a rule, are very widespread and very weak in this patients. To enter directly into the therapy of spondylolisthesis, we have to take into account 2 basic aspects that we mentioned earlier. Remember that this disease always starts, either in childhood or in adulthood, from a contracture in the ischiotibial muscles. Therefore, the first approach to the treatment will be to work on the ischiotibial muscles, overcoming the contracture or reducing its size, and by doing so, achieving better stability of the sacral bone, and then working the cervical region. Let's remember before I start doing these maneuvers, that in the first sessions we will use, as mentioned previously, sacris in the region of the sacrum, and in the cervical region, to work directly in the correction by irradiation of the rest of the spine. And then we will work from the 3rd or 4th session, placing Cordus normally in the cervical region, in the dorsal region, in the lumbar region, and in the sacral region, as it has its evolutionary follow-up. And also remember that once the therapy is finished, either with sacris or with Cordus, we will go back to work with the ischiotibial muscles, which is where the problem essentially begins. Now I am going to demonstrate different exercises that help to achieve a relaxation of the ischiotibial muscles. In this case, we will see that this patient arrived with a spondylolisthesis, and is referring a pain towards the left leg. This is the first thing that we're going to do to achieve a relaxation of the ischiotibial muscles. We are going to take her affected leg and raise it up at a 45 degrees angle from the surface of the bed. And we're going to perform an exaggerated dorsiflexion, as if we were doing the Braggart maneuver. And we'll tell the patient to stay that way for approximately 30 seconds. It is important that during the performance of this exercise the patient has a support in the cervical region. To help maintain the lordosis in the cervical region, the patient must have a support in the lumbar region, to help maintain the lordosis of the lumbar region. And this facilitates the work to be better in this area. Why not keep this exercise for more than 30 seconds? Because remember that if we keep a leg flexed for more than 30 seconds, spasms and contractures in the sacroiliac muscle can be caused. And the sacroiliac muscle can then cause tension or displacement of the vertebra we are working on. Being the patient in this position, we are going to ask her to descend the opposite leg slowly, and to leave it hanging in this way for 15 seconds, until we manage to reduce and correct the deformity that is occurring in the ischiotibial muscles, and acting fundamentally in the affected vertebra. Once the 30 seconds are over, we ask the patient to return her leg to its normal position and descend the affected leg. We can do this if the pain has not radiated towards either of the legs. We can do it bilaterally, with each one. 30 seconds, 30 seconds, 30 seconds, 30 seconds, until we complete an amount of 3 exercise sessions. If the patient presents some discomfort caused by a given cause, or because the sciatica pain that she has is very intense, we can do a second variant of exercise to also achieve the stretching of the ischiotibial muscles, taking into account that the right leg is the one that is affected. We are going to ask her to sit on the bed with her right leg stretched out on the table. Once the leg is placed in this position, we are going to ask the patient to perform an exaggerated dorsiflexion of the foot, keeping it in that position. Or even, if the patient has a suspension band, she could place it and stretch it with her own arms. And then, to achieve what is called the meningeal stretch effect, which is very affected in spondylolisthesis, we are going to ask the patient to perform a trunk flexion. And in order to make the meningeal effect even more accentuated on the lumbar area, which is the most compromised area, we will ask her to do a cervical flexion. In this way we are able to completely relax the ischiotibial muscles of the leg. We manage to relax the meningeal component, and we can improve the patient's postural dynamics. We keep this position from 30 to 45 seconds. And then the patient can lift up, elevating her trunk, and can now sit up, and descend her legs. This can be repeated with one leg or with the other up to 3 courses, to achieve the desired therapeutic effect. A third option to achieve the stretching of the ischiotibial muscles. When we are not going to use a bed, or do not have the proper conditions, or when the patient does not have the right height for the bed, is to perform it with the patient in a standing position. For that, we will ask the patient to try to maintain an upright posture while placing a book or anything else with a hard material, with an elevation of around 5 to 8 centimeters. To place it at the foot of the patient, raise her feet in dorsiflexion, and place the tip of her feet on it. In this way it is also possible to position and stretch the ischiotibial muscles. And in order to achieve the same effect that we wanted to perform on the spine, especially at the level of the lumbar region, we ask the patient to do a flexion only of the neck, and stay in that position for 30 to 45 seconds. This can be done in 2 to 3 courses to achieve a complete stretching of the ischiotibial muscles.